This is a tall boot. It's typically used for any ankle injury, tendon injury, or anything like that. If you have an Achilles injury, ankle sprain, or anything where we really want to shut down ankle range of motion, we're going to be using this tall boot. Now, the use of this tall boot is ranged from right after the injury occurs or after post-op, or if you have a fracture and you've been in a cast, moving to the post-op this tall boot is really going to be your next step in treatment. So what we're going to do is we're going to first start off with ACE wrap application. ACE wrap's very important for blood flow. It's going to help reduce swelling, and it's also going to really help prevent any kind of risk for a blood clot or a DVT. Your provider is really going to talk to you about that. When you shut down your ankle and you don't have any ankle range of motion, so if we stop that ankle range of motion, that musculature is going to stop contracting, and blood flow is not going to be as optimal as it would be if you were walking around as normal. So what we want to do is we want to help that blood flow. We want to kind of eliminate all that swelling, and we're going to do that with ACE wrap or a compression sock. ACE wrap really is used if it's hard for you to really pull up a very tight compression sock. We're going to use this ACE wrap to help with that compression. And we're going to start at the toes and we're going to work our way up. That's always the most important thing with ACE wrap. You want to make sure that you're starting from distal, from the tip of your toes, and work your way proximally, so up towards the core of your body. When I'm taking this ACE wrap, I want to make sure that I'm not yanking it all the way, because you can make it so blood flow is not good, and you can turn this into kind of a tourniquet. Want to make sure that we avoid doing so. So if I'm looking at my ACE wrap, if I pull it out all the way, I want to bring it back like halfway. That's the amount of tension that I really want for my ACE wrap. We're going to start at our toes so you can kind of just barely see through this. That's the tension that I want. And I'm going to overlap by a half. I'm going to work my way up, and I'm overlapping by a half. And when I say overlap by a half, this is our first layer here. I want to just overlap it so that we overlap the half portion of it. And I'm just going to work my way up. And again, I'm keeping that same tension all the way up. We really want to make sure that we get this kind of past the calf. Popular kind of symptoms for a DVT or a blood clot is constant calf cramping, deep calf pain. We just want to make sure that we go past that calf as well. So if we need an additional ACE wrap, we will do so. So what we'll do is, if we're opening up a new ACE wrap, we would just take this and we would just do the same amount of tension, working our way up. And once you get to the top, you can either cut it, add some tape, or you could just kind of finish it off right up here. We just want to make sure when we're finishing it off, we're not tightening it and ruining that compression that's milking that swelling all the way up. So now that we have our ACE wrap on, we're going to move to our tall boot. And this has just two pieces to it. So it has these straps here, and underneath these straps, I'll take this off like this. So once we're done with these straps, I always like to fold them on themselves because they will stick to anything. So I just like to fold them up. You have this shell piece that comes right off. I set that to the side, and then it opens up. We have some directions here. Again, I'll put those right there. Sometimes we'll give them to the patient just so they know. And then you're going to be left with just this open part right here, and this is where your ankle is going to go. So your ortho tech is going to take your ankle. We're going to kind of have you just relax that ankle down, make sure it's pushed all the way back. You want to make sure that your toes are not sticking over, and you want to make sure that you don't have too much space, so it's like a clown shoe. You want to make sure it's just right. You're going to take this, you're going to fold it over. You're going to take this and you're going to fold it over so you have both of those Velcro pieces. We're then going to take our shell and we're going to make sure that the lettering is pointing towards the toes. We're going to stick that right on top there, and that's got Velcro, so that's just going to stick right in place. And then we're going to strap it up nice and comfortably snug. So we're not going to do it too tight, and we're not going to do it too loose. Again, I'm going to continually say comfortably snug. That's pretty much our go-to saying here is we just want to make sure that we're not cutting off circulation, we're not causing any damage by it being too tight, while we're also not making it too loose where you're going to get motion. It's still going to be shutting this down. Another feature of this boot is that you have two separate air bladders, and this is going to really, it's an optional portion. It's going to help kind of stabilize the ankle a little bit further. Want to make sure that we kind of fill in the gaps. You can kind of imagine this as a cylinder around your ankle, and the air is going to make it a little bit more custom and help kind of further immobilize your ankle. And then we have two separate air bladders, so we have one labeled number 2 right here, and on the inside we have one labeled number 1. And we have this dial that controls both of them. So you can kind of see that this one says number 1, that means it's controlling this side. This, we switch it over towards the left here, clockwise, and this turns to number 2, and that controls the other side. Want to make sure that these are both separate, so we want to make sure that we pump these up equally. So we want to make sure that we're not lopsiding one where this side's more inflated than the other side. So I like to start it off with a number of like 6 or 7, just to make sure it's a kind of a small number. We'll go 1, you'll press this button here, 2, 3, 4, 5, 6, just until you feel something behind your heel. And then we're going to switch to 2. We're going to do the same thing. 1, 2, 3, 4, 5, 6. It's important when you're pressing this that you're making sure that when you press it, it comes all the way back up. Okay? So once we're done, we have these both inflated equally. You're going to lock this in place. That's going to make sure this little lock here is so that when you press this or press this, any button here, it's not going to mess with the air in there. When we're ready to take this off, you're going to switch back to 2, and you're going to press this button here. This is the air release. You're going to just press it and hold it down. You're going to hear a little kind of air squeak. That's just the air coming out, and you want to hold that for just a couple of seconds. You'll switch back to 1 and do the same thing. Now we're ready to unstrap it and take it off. One important thing to know is that it's very important to deflate the air every time that you do take this boot off. If you were to just take this boot off without deflating the air, that air bladder is just going to kind of bubble up, and it's going to keep pushing your toe closer and closer to the edge, to the point where your toe is going to be sticking out, and your ankle may not be in its proper position that we want it. If you have an Achilles injury, sometimes your provider might put what we call lifts into the boot that'll go underneath everything, and it'll put you in what we call plantar flexion. So your ankle is going to be more pointed downwards than up in that neutral position. And that's it for fitting a boot. All you'll do is just unstrap it, and then you're ready to go to take it off.